Hello, everybody. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I hope everybody had a great long weekend. So it seems like every Monday, or in this case Tuesday morning, I get an email from a patient asking a question about a medicine. Usually it's a statin, which, as we all know, is used to lower cholesterol. And it always refers to something they heard from a friend or read on the internet, and it's always negative. So this morning was no different. Today's topic explores what's called the Nocebo effect, the design and the findings of the SAMSON trial and its implications for medicine. So what is the nocebo effect? Well, it's a phenomenon where patients experience adverse effects due to negative expectations rather than the pharmacologic action of a treatment. And this has become a critical area of study in medicine. Unlike the placebo effect, which involves positive outcomes from inert treatments, the nocebo effect underscores the power of negative beliefs and expectations in shaping health outcomes. One of the most compelling studies to demonstrate the nocebo effect in clinical practice is the SAMSON Trial, which stood for the Self-Assessment Method for Statin Side Effects, or Nocebo, published a few years ago. This landmark randomized trial compared atorvastatin, which is generic Lipitor, and a placebo, providing robust evidence for the nocebo effect. The nocebo effect occurs when patients experience adverse effects solely due to negative expectations about the treatment. These effects are not caused by the treatment itself, but are instead driven by psychological factors such as negative communication from healthcare providers. Warnings about potential side effects can inadvertently prime patients to experience them. Media and social influences. Reports that adverse effects from medication or treatments can shape patient expectations. And prior experience. Patients who've had negative experience with medications in the past may be more likely to anticipate similar outcomes. So the nocebo effect is particularly relevant in the context of statins, which are highly effective at lowering cholesterol and reducing cardiovascular risk, but are often associated with reported side effects, particularly muscle-related symptoms, which we call myalgias, which are muscle pain. These side effects can lead to poor patient adherence or discontinuation of treatment, even when the symptoms are not caused directly by the medicine. So the SAMSON trial was published in the New England Journal of Medicine, which is the premier medical journal, in 2020, and it was a groundbreaking study designed to investigate the role of the nocebo effect in statin-related side effects. The trial was conducted in the United Kingdom and involved patients who had previously discontinued statin therapy due to, as it was quoted, intolerable side effects. Well, what were the key findings? Well, patients reported similar levels of muscle-related symptoms during the atorvastatin and placebo phases. The intensity of symptoms was significantly higher during both the atorvastatin and placebo phases compared to the no treatment phase. So those are patients who did not get any treatment. And notably, 90% of the symptom burden reported during the atorvastatin phase also occurred during the placebo phase, suggesting that the symptoms were not directly caused by the drug. The study concluded that the majority of statin-related side effects were due to what is called the nocebo effect, which is negative expectations about statins influenced by prior experience or warnings played a critical role in shaping participants' experiences. So in conclusion, the nocebo effect is a powerful and underappreciated phenomenon in medicine with significant implications for patient care and treatment outcomes. The SAMSON trial provided robust evidence for the nocebo effect, demonstrating that negative expectations can lead to real and measurable adverse effects, even in the absence of pharmacologic action. By addressing the nocebo effect through improved communication from the doctor, patient education, and innovative research, healthcare providers can enhance the quality of care and improve patient outcomes. As medicine continues to evolve, recognizing and mitigating the nocebo effect will be essential for optimizing the benefits of treatment while minimizing unnecessary harm. So with that, I hope you learned something today. Thanks for listening. If you want more information, you can go to my website, www.palads DINMDS.com. And thank you again.